take our time. So it's been really good. But again, look forward to working with you all. And
Okay.
let me know if I can help out in any way. Anyway, I'll be around.
Thank you very much for coming down. We really appreciate it. Thank you. And welcome. Okay, now we're going to officially call it to order. I'd like to start with, we do have a quorum, and we do have enough members here, and we have a lot in the audience as well. So why don't we go ahead and with introductions. Dave Betzler, Chair of the Regional Advisory Council.
Margaret Hunter, the Myron Stratton Home.
Cynthia, Referrals practice. Fellows Highlands Eastern El Paso. Jen Neville, Community Health Partnership.
Be Babbitt, Northern El Paso County.
Francine Juliet, El Paso County. Joanne McCoy, El Paso County Department of Human Services. Garbani, Area Agency on Aging.
Carrie Schillinger, Area Agency on Aging.
Jerry Novak, Colorado Springs.
Joe Urban, AAA. And with our guests, let's just start in the front row here, if we would.
Nancy Bistak, Fountain Valley Senior Center. April Larry, the Fountain Valley Senior Center.
Janice Crosser, Fountain Valley Senior Center.
Abby Lowry, Color Senior Coalition. Lisa Aldridge, Area Agency on Aging.
Tricia Gordon, nurse practitioner at the Primary Care Clinic at UCCS. Ann Ellis, Silver Key.
Michelle Vulcan, Community Dental Health.
Emily Gambo, UCCS Health Circle. Nicole Cata, UCCS Health Circle.
Francis Treatish, Dietitian, UCCS Health Circle.
Paige Whitney, I'm with the Health Circle.
Susan Sanders, I'm just an interested member.
Gretchen Bricker, the Area Agency on Aging.
And I think that's everybody, right? Did we miss anybody? All right. So we have the agenda before us, so any changes to the agenda? If not, I think we can pass that as a consent item. And the minutes are also attached. That's from the 22nd of February meeting. Any comments or questions?
Okay, go ahead.
I make a motion to
Okay.
accept.
Accept the minutes.
Second.
Second. Any discussion? Okay. All those in favor? Aye.
Aye.
All right. So, public comments. Are there comments that need to be made at this point that are not on the agenda? Members who wish to speak to the council?
I would like to say, we went to the senior.
Is that microphone on? I'm not sure everybody can hear.
We went to the senior deal in Denver. I enjoyed it very much. It was very enlightening of what's going on up there as per se what's going on down here. I do have the information, if anybody would like to take it and read it as to per se what they're doing. I have it over here. More than welcome to have it. I think he has some also. But I just brought it because I've already gone through it, and it's interesting. It was a very interesting day.
So what Phyllis is talking about, the Colorado Senior Day at the Capitol, March 21st, so last Wednesday. And we have some materials that we brought back from that. Phyllis went, and Lucy Crandall and I went up there, and then there were a bunch from the AAA as well that were there. Very worthwhile. We can talk about that a little bit later, but there are some materials that really encourage you to take a look at it. I think the other thing that's really important just at a top level would be a lot of information sources were provided at that conference as well. So that there are other things that, rather than, we get an understanding of some of the issues here, but perhaps we don't have a chance to look at a study or a report or something else that perhaps provides more context, a little bit more depth. So there's a lot of good information that was made available at that Colorado Senior Day. Any other public comments then? If not, we're moving to the special practice manager, and I think that. I'm sorry?
So my providers are actually going to present to you guys.
Okay,
You get us.
great.
Lucky, huh? All right, technology here.
Hit the letter B on the keyboard.
Fantastic. I didn't know that secret. Well, welcome. Thank you, everybody, for having us. We are from the UCCS Health Circle. So my name's Paige Whitney. I'm the director of the Center for Active Living there.
I'm Frances Treat. I'm a registered dietitian.
I'm Tricia Thornton, one of the nurse practitioners.
And so we're going to give you just a little bit of an overview of what these 3 clinics have. How many of you are familiar with the Health Circle at Lane Center and or, yes, any of the clinics? Some of you? A little bit, yeah. The Aging Center, I know Dr. Sarah Qualls is highly involved, and so we work closely with her. But these 3 clinics specifically, we're actually associated with the Bethel College of Nursing and Health Sciences. And so we have we'll go into a little bit of an overview and then discuss specifically.
Sorry, that was totally my fault.
Hey, it's okay.
I'm trying to get this to amplify, it doesn't want to behave.
It's a fancy system you all have.
Well, it's
So before we get into the clinic specifically, we just wanted to bring up a quick snapshot since each of us do have, we work specifically with the older adults. So as most of you probably know, by 2060, Healthy People 2020, CDC, are all projecting that individuals over 65 are going to double by that year. And so that provides rationale for why, our services and the things that you all do within this area are so important. And so the other thing that we know from research is that most people, as we age, our systems are slowing down, and so the development of chronic conditions is something to be aware of and something that can happen. And so heart disease, cancer, bronchitis, stroke, diabetes are some of the most common. And so what we can work is in a preventative way through the integrative model in which we have at the Lane Center through these Bethel clinics to help reduce that, maybe get people involved in a healthier lifestyle. And so most of us know that there are barriers to behavior change. So my guess is each of us can identify a time in which we've tried a new physical activity routine, trying to eat better. Maybe it's an environmental barrier, maybe it's a psychological, maybe it's, you don't have the right attitude or you're not as excited about it. You don't have that drive or motivation to do it. Or maybe it's physiological. Maybe you're just in too much pain to get up or you're too tired. A lot of those conditions can have these types of side effects to help perpetuate the difficulty to make behavior change. And so that's really where our niche is as the Bethel Clinics, because we work as an integrative approach. So within Lane Center, there are actually 7 different clinics, and so 3 of us here are representing just the Bethel Clinics. And so we have primary care, we have nutrition, and physical activity. And so we're able to address the individual as a holistic, from a holistic approach. So you can have all different aspects. And then not only do we take into account that individual, we take into account the family circle around that and also the community. So being involved with the university, we also have students which are embedded in each of these clinics in which we're helping to prepare. So in short, our mission is to simultaneously provide high client care while also educating the future healthcare professionals. And so now we'll go into a little bit more of what each of the 3 clinics, Center for Active Living, Peak Nutrition, and Primary Care, do to help provide services. And at any time anybody has questions, let's leave this as a discussion. So I'm not necessarily talking at you, but if you have any questions at any time, please ask.
Can I ask a
Yeah.
question? The term holistic is used really
Yeah.
a lot anymore, and I've seen different definitions. You have it prominently on your brochure, and you
Yes.
mentioned it several times. What's your definition of holistic?
That's a great question. So my definition probably is going to vary from a lot of others. When I think of holistic, I think of it approaching the whole person from a psychosocial aspect. So looking at not only the physical condition, so physical activity, nutrition, but also looking at the mental health state. And then what does that outer bubble, so going back to that other slide, how's that support system? Because from a health perspective, that support system is key. And then what is the community doing to help support that as well? And so I think there's different levels of holistic, but really from my perspective, and chime in, it's that well-rounded, so looking at all aspects.
Thank you.
We're
Yeah.
not going to look only at the heart or only at the lungs or certain systems of the body. We're looking at the whole person.
Now the interactions between those.
Yep.
I understand. Thank you.
It's everything.
One other thing, Paige,
Yeah.
I think you said that there were 3 Bethel clinics, primary, nutrition, and physical, or those 3?
Yep.
That's what we're hearing about now, but there are
That's
a
what we
total
have.
of 7?
Yeah, there's actually 7 clinics within the Lane Center, which is a unique opportunity for co-located clinics. So we have the Aging Center, which I know many of you are familiar with. There's Veterans Health and Trauma. Peak Vista also has a site there, as well as the city employee clinic is now located there in addition
Okay,
to our
okay.
3 clinics.
Thank you. That was
Yeah.
good clarification.
Yeah, absolutely. Any more? Yeah. Yes, for the most part, I think Nicole could probably speak to that mostly. But if people would like to drive, it's open to anybody. So if they want to travel farther, we're welcome to bring them in. Yeah.
I do have a lot of patients at the nutrition clinic that come from pretty far as Kansas and New Mexico even. So, yeah, we have them from all over the state. So.
Primarily, yes. So I will dive into a little bit of the physical activity. So I'm the director here at the Center for Active Living, and so once again, our mission is really working together with the community as well as the students with a physical activity approach. And so when thinking of physical activity, especially focusing on an older population, which most of our clients are, we have to look at the idea to help mitigate fall risk. There's a lot of money associated, a lot of pain, a lot of just family systems that are disrupted from a fall prevention standpoint. And so we look at 4 main areas of physical activity within the Center for Active Living. So balance, which is huge, which is oftentimes overlooked as its own entity of physical activity. We also have strength, cardio, and flexibility. And so these pictures help highlight some of the things in which we are able to do and some of the populations in which we work with. Once again, seeing that those students are there helping out. And so we have a variety of different services. Wendy, up there in the left-hand corner, is our functional fitness expert. She is she has a master's in strength and conditioning, which sounds a little intimidating, but it's not terribly. But she couples that then with corrective exercise. And so she actually is able to assess through a series of subtle movements the imbalances that may exist. And so with muscle imbalances, those can potentially lead to injury down the road. They can disrupt gait, they can disrupt posture, and those types of things. And so she looks specifically at the body as this whole kinetic chain to help identify any imbalances and then develop programming around that to help mitigate those imbalances, to help people do what they like to do in a functional and safe way. And so she does that on an individual level. So we do have sessions available for individuals. If you want to meet one-on-one, she can also do the personal training. We also have small group. So if you have 2 or 3 friends that want to come along, bring them along and Wendy can do a smaller group. And then we also have a strength and stability series, which is primarily focused on balance, but we're integrating different types of physical activity. For example, our next series, which starts on the 11th of April, is actually a Tai Chi series. So it'll be 6 weeks, and it'll be Tai Chi, which we all know is good for balance, mindfulness, as well as strength. And then the other unique populations in which we work with at the Center for Active Living, we have Parkinson's-specific classes. So both Wendy and myself are certified for Parkinson's wellness recovery. And so we have 4 classes, about 40 participants at this point in time that are working with us. And it's anywhere from a 2 to a 4 stage of Parkinson's. And so we have even those people coming in with their assisted walking devices and wheelchairs so that they can get the physical activity, because that population is often overlooked. And then we also have the ability to work with the populations to provide research, since we are, once again, with the university, which is a unique aspect we have. We also are working with the City of Colorado Springs for worksite wellness programming is something else we have going on. And then once again, just reaching out to different populations. We're looking to run an osteoporosis prevention program and some other unique strength and stability series. Yeah.
What is the recovery component of your Parkinson's program?
So that's just the name. So it's actually out of Tucson, Arizona. It's a Parkinson's wellness recovery, and I don't actually know.
Okay.
But really, what it is, it's a physical activity baseline or foundation in which you use for individuals with Parkinson's. So really work on the opening up, which can be compromised by some of the systems in which they have and some of the symptoms. And then it also works on the cognitive piece, so that dual function, which is really great. And then once again, what we're finding from the research, doing with our participants is that social support aspect is huge. So I would say, I mean, from my point of view, that recovery is the ability to be in a class and exist with other people that are like you to help reduce that stigma. That's something that's huge coming out of what we're seeing. Yeah, so great question. So in short, when looking at physical activity, engagement and motivation can oftentimes be very difficult. And so as people enter into the Center for Active Living, we want to make sure that you're ready. Identify where you are on that continuum of physical activity. Our niche is actually working with individuals that are just looking to get started because of Wendy's specialty, her ability to work with individuals and really understand what's going to be best for them and to really help understand their meaning and what makes them move. We're not just going to put you on a treadmill because not everybody likes a treadmill, but what are the things that you like to do? Maybe it's playing with your grandkids, maybe it's going out hiking, traveling. Those are some of the daily activities that we like to use to help put programming together so that it has meaning and value to the individual. And then, as I touched on with the Parkinson's specific, there's social support, but then we also have that intergenerational, so the students who are working one-on-one with the participants to help challenge them to an extent because they are another physical barrier to help reduce fall risk in these classes. But then it creates this sort of conversation back and forth, which is really great to watch. And once again, through the focus groups in which we perform, is something that everybody touches on that's of value in our clinic. So that's
Do you deal with Alzheimer's or dementia?
So we have a few. So we work with the aging center. Sometimes we will get referrals down. So Wendy's been working, I think she has 1 or 2 clients that have had that just because the research shows that physical activity can, help increase that mood and the memory and yeah, exactly. And so the dual function part of that, we don't have a specific class or program for it, but absolutely we're open to what we have is a unique setting, and it's a really intimate space too, if you see it. So it's not an intimidating big box gym, which sometimes can be difficult. And so it's a prime setting for somebody who, is just looking to get started or wants to move to the next level, really anywhere. So we're lucky to have Wendy and her specialty in that respect. So yeah.
It applies to you, but also probably the other 2 clinics as well. Funding? How
Yeah.
are you funded? You're accepting new patients, so that implies that there's a donation or a contribution or a fee of some sort.
It's a
So
little
that'd be
bit
interesting to
of
hear
an
that.
interesting system, but we do receive some funding from the college, so nursing and health sciences. So we are a combination of the nursing and health science, so primary care, and then health science will be peak nutrition and the Center for Active Living. But there are small fees associated with the classes so that it's a coupled approach in that respect. We have had some grants and some other, so for example, our Parkinson's groups, we received a small donation from the local Parkinson's Foundation to help get those up and running. And so it's sort of a combination of different programs, and I think each clinic has a unique fee schedule in that respect.
Okay, thanks.
Yeah. Any more physical activity questions?
We'll
Yeah.
go to ours in a
So
minute.
do potential clients, if they need like a referral from their primary doctor, they can just go?
Yep, so anybody can present, but we do so once we have that initial conversation, if you are working with a physical therapist, oftentimes we get that continuum of care, or working with a primary. Oftentimes we like to just check in with the other providers to help ensure that we see the whole person before we see you, but yeah, so.
And they don't need to have insurance?
No, so so it's yes, we don't accept insurance, so it's a positive in the fact that we don't have to go through that, but it can be a hindrance with respect to payments. But yeah, great question. Thank you. All right, Frances.
I'm Frances. I'm the registered dietitian. My title is outpatient clinical dietitian. A lot of people are not really clear on what that means. It's a pretty wide variety, so when someone has any sort of medical condition, I can treat it on the nutrition side of the house. We do work with a wide range: diabetes, cardiovascular disease. I've had a lot Parkinson's patients. I've had Alzheimer's and their caregivers come in. Alzheimer's patients bring their caregivers, and together we can work with swallowing difficulties texture issues, things like that. If there's any mobility issues at home, we take into consideration a wide variety of conditions and diseases. We also do weight management, weight gain, weight loss, a lot with the aging community. We deal a lot with maintaining that weight or putting on weight because the appetite can drop as we age. And so we do address that with caregivers also, making them aware of some of the things metabolically that can happen with patients that come in. So what happens during our assessment, we do one-on-one, but we also can do groups, depending on if a facility wants to hire us. But for our one-on-one, it's an hour assessment initially, and we will go through medical history, surgical history. We will try to get a 24-hour recall of what they've eaten as best as we can, activity patterns, any barriers to change, any barriers financially or barriers with the home environment, equipment, availability of food or food insecurities, basic weight history. We do a lot of, we get the weight, BMI, if we can get them on the scale, we can get, their lean tissue and their hydration levels. So if their hydration levels drop, we can actually see that through our bioimpedance scale. So we get as nice wide of a picture as we can of that person before we will do what we call the nutrition diagnosis. And once we do a nutrition diagnosis, then we will set up an intervention. And the intervention, we set goals for that person. We want to be achievable goals. Sometimes they can be minimal and achievable to the point where we're making baby steps, and some people make big steps towards those goals. Follow-ups, we do encourage follow-ups. They're 30 minutes. And we reassess, basically, and then set new goals and find out if they're moving forward, what needs to be changed. We do encourage follow-ups because if we can get them connected with us, it keeps them on their program and it keeps them moving forward. I do think that working with Alzheimer's patients and their caregivers, I think, is an opportunity that is missing in this setting. Parkinson's, I've had Parkinson's where there are special diets for Parkinson's patients that a lot of people really aren't aware of, and so I think that's a area that can be improved. We also, again, we do group counseling also. This is per request. We do have a teaching kitchen downstairs. We're right now brainstorming future cooking classes and that sort of thing. We've actually brought up in our meetings having possible cooking classes, helping with caregivers or helping with, I've worked with bariatric patients, pre and post bariatric surgery patients, all kinds of different areas. So that's more of a per request. So if there is an organization that wants to come in and learn, we can address that too. Any questions?
I'd just like to comment. This would have been really helpful. A few years ago, my uncle, who's recently has died, but he had dialysis and peripheral neuropathy. So that was a real challenge for his wife and caregivers to go ahead and try to figure out, okay, how do you balance that diet? So that would have been really, really huge.
What I love about us is that we're so integrated that if we need labs and we have that primary care right there, so if someone came in with renal issues, we can get labs to find out if their potassium is off, or if their electrolytes are off, or if their protein is too high, and then they can come in to see us. And at the same time, if there's any balance issues or anything going on, then we have the Center of Active Living. So it all sort of works together. That's what I love about it. And we encourage people who are dealing with a chronic illness. We encourage them to go through primary care, possibly get their labs run, and they're right there. And then once they're in, they can transfer those over to us. They come see us, and we can assess and put them on a program.
would think it'd be pretty complex as far as medical records shifting back and forth, though, like he would have been under the VA. So you have medical records, privacy, and HIPAA, and all that kind of stuff would have to be transferred between the 3 different organizations, 2 or 3.
Absolutely,
Complex.
yes. Yeah, we have the paperwork, and we are all HIPAA compliant with all of that, so that's, rest assured, that's all, that's all in place, yep.
The health trauma clinic has lots of beds, and we're actually working on sharpening or fine-tuning that medical record sharing, because it
Okay,
is quite
that's
a few
huge.
percent.
Yeah.
That's
Familiar
huge.
with what you need.
Yeah.
Yeah. Okay, thank you.
So, any other questions? No? Okay. This is Tricia. She's primary care nurse
Yes.
practitioner.
The third clinic, so Bethel funds us, essentially. The College of Nursing and Health Sciences, our overhead is primarily taken care of by them. And so our mission is there at the bottom, partner with and empower you, the individual or patient, in a nurse practitioner-directed environment where holistic clinical practice, education, and research, they intersect to help achieve the individual or patient's healthcare goals. So we include the individual in the goal setting, and so a nurse-managed clinic, the definition is that it's directed by nurse practitioners. We have no medical doctors or DOs under our roof. We do have doctorate-prepared nurse practitioners. So 2 are wrapping up programs, and I'll get into more. I'll tell you more about each of the providers after this here. So we're essentially like many primary care clinics. You all probably have one and are familiar with them. So the prevention piece is such as screening tests, if we're doing routine screening for cancers or immunizations. The chronic care could be like diabetes, high blood pressure, cholesterol, all those long-term disease processes. We help manage those. The acute illness or injury, if it's a sprain or strain. We do sutures to a degree. If it's complex or facial, we don't do suturing for that, but we do minor suture repairs. So a lot of primary cares around town, they do all those things. So we do what your primary care office does. So the other things I'm about to discuss, it could be hit or miss if some primary cares have this. I want to share it with you because we have it all in our office. So behavioral health, it's integrated into our primary care. Excuse me. So that is Phyllis Austin, and she is a psychiatric mental health nurse practitioner. She does medication management mostly. We're also here in the near future going to be bringing on a psychologist, likely full-time. It might be part-time in the beginning, and we anticipate it becoming full-time very quickly. And then the women's health piece. So some folks, they might go to their primary care for an annual physical, but then for the female piece need to go to a OB or a different office. Well, we have Mary Claire Wall, and she is a certified nurse midwife. So she's in our primary care clinic, available for women's health. You don't have to get in the car and drive somewhere else and make a different appointment, and sometimes it's difficult to manage if you have different providers at all different places, but we've got it all here under one roof. And then the geriatric specialist, there's Lori Mattingly, and she's an adult geriatric primary care nurse practitioner, and she's one of our providers who does have a doctorate level education. She's a DNP. She's also faculty at Bethel, and I have a geriatric background as well. So I've been in healthcare for 14 years. 8 years of that has been as a nurse practitioner. And then the first half or so, about 4 years, I was in urology. So that's men's health and the urinary system. And then this more recent half or so, I've been in geriatrics at the PACE program in town. So I had great mentors there, Dr. Sickbird and Paige Atwood. They helped prepare me caring for geriatric population quite well. So some of those pieces is pretty standard primary care, and some of it is unique to our primary care office. So we have all different specialties all in one place, and that's listed on the flyer there that you've all been looking at off and on too. So I kind of mentioned the men's health piece, the family nurse practitioners. There's pictures here in a moment, and I'll review again who each of us are, just so you can put that face with who we are. So the FNPs are Deb Tuffield and Angela York, so they can see all ages. Deb Tuffield also has an interest and expertise in the transgender population. It's actually pretty rare. There's only 2 to 3 providers in town with that background and specialty. And again, the behavioral health is integrated. So that's me. I told you all about me. Maureen, she's another family nurse practitioner, so treats all ages. She's been in the urgent care community recently, so some people are familiar with her name from there, but she has many decades experience as a nurse practitioner and an Air Force background. Angela is the next one to the right there with the scarf. She's the full-time provider, so Monday through Friday, she sees patients about 8 till 4. The last patient being at 4, so that if it is a new patient, every new patient gets 60 minutes, a full hour. So that gives the patient more face-to-face time with their provider. It allows for more time, not only for questions, but for appropriate answers and for education, because that quality care piece, that's a huge part of our mission. Quality care takes time. So a new patient is 60 minutes. A follow-up or revisit is 30 minutes. So we don't have an NP visit for 15 minutes. It doesn't exist in our clinic. So we build in time. And then so the next one on the right, the last one is Mary Claire, the certified nurse midwife. And she can see girls 12 and up, including up and up. It doesn't stop on the up, including geriatrics. And then Lori's on the bottom left there, adult gero primary care nurse practitioner. She was, Optum is where she was somewhat recently. So they did geriatric home care. She was in the homes for that. She also rounded at assisted livings with a physician with his practice. And then next to her, that's Phyllis Austin, so the psychiatric mental health nurse practitioner. And the last one there is Deb. Excuse me, sorry. So Deb is the family nurse practitioner. She's there part-time because she's also faculty. So being faculty at the Bethel College of Nursing and Health Sciences. Mary Claire is also faculty, and Lori's faculty. So Angela, Maureen, I, and Phyllis are not faculty. Did I get that right? So we accept all major insurances, including Medicare and Medicaid. I was here at the RAC, I want to say January, and I stood up as the guest saying, yoo-hoo, we're accepting patients, because it just is so common that a primary care clinic, while they may accept Medicare and Medicaid, they sometimes get capped. They sometimes can't accept new patients with those insurances. So we're not capped at this moment. We don't anticipate being capped any time in the near future. And then just a good point to make, too, I think, is since we are open to private insurances, if there's a supplemental, if someone has Medicare and a supplement, we oftentimes can take that as well. We hate for folks when they're paying out of pocket for that piece if the office can't bill it, that's really not helpful to those folks. And so on the flyer there, I think most of you picked some up, which is great. Are there any questions on that flyer there or anything?
I don't know if you want to mention about the care coordinator's role in the clinic and how that can be helpful.
Absolutely, yeah. So Carrie, our registered nurse, she does do care management and for all patients in the clinic, whether it be if someone needs closer follow-up for any reason. It could be someone newly diagnosed with high blood pressure, for instance, or newly diagnosed with diabetes. And we're monitoring, say, the blood pressures or the blood sugars. If someone needs a little extra education, information, follow-up, if we need to wrap our arms around them a little more to help stabilize, that's kind of part of that care management piece. So she's a great asset. She helps the providers a lot. Thanks. Our values are there in the middle. Pretty self-explanatory, but they're shared values with the 3 Bethel clinics. By all means, the other Health Circle clinics very likely overlap with a lot of this. Accountability, care, collaboration, commitment, dignity, integrity, quality, and respect. And then in the center, I tried to do a picture of our mission statement with the holistic clinical practice and the research and education all intersect. And then we're centrally located, the Nevada Strip Mall, if you will. Lowe's is to the left of Nothing Bundt Cakes. So I've often heard Dr. Sarah Qualls say it's at the level of Lowe's. And then we're just on the other side of Nevada there, and that's what the building looks like on the outside and the foyer on the inside. Primary care and Peak Nutrition Clinic are on the 2nd floor, but there's an elevator. It's kind of to the left of the chairs there. CAL, the Center of Active Living, is on that main or 1st floor. And then the Aging Center and the Vet Health Trauma Clinic are on the 3rd floor. And then the City Employee Medical Clinic and Peak Vista are neighbors with primary care and Peak Nutrition Clinic on the 2nd floor. So, any more questions? Anything at all?
Do you have pricing for uninsured?
We do, yes. So it's a sliding fee we pay for folks. Some people think, oh, everybody has insurance these days, but some people don't, or they're between. So we can see them as well. It's pretty affordable. Thanks for mentioning.
I don't have a question, but I have a comment. The higher ed institutions in the state of Colorado have kind of taken the lead, being apparently the only people that know that we have a rapidly aging population. And I think the Lane Center is probably the best example. University of Denver has a very active program. CSU has started a new program. But without a doubt, UCCS is kind of the leader in the state of Colorado, and Bethel in particular, with regard to how we bring a unified approach, a holistic approach. And if you haven't been up to the Lane Center, I would certainly encourage you to take a visit through there. Looks like an office building on the outside, but there's lots that goes on the inside.
Well, thank you for that comment. Yes. I should have mentioned, too, so that is where the clinic is, the primary care piece. In the near future, we plan to go to patients. So we're going to start that whole venture with an assisted living. Very likely Morningstar at, is it Mountain Shadows? Thank you. I mix up my M's with the morning and the mountain. So they have the honor of the best of assisted livings for 2018. They earned that award. A partnership is is forming as we speak. But that home care piece and going to the assisted living, especially if it's the secure area, or they have a locked memory unit of 19 beds, it doesn't make sense for them to get out of bed and have transportation, and by the time they get to the office, their world is rocked. So Lori, myself, and Maureen are working on that piece. Thank you so much.
Thank you so much.
One other comment, sort of piggybacking on what Joe was saying too. I'm really impressed with this, and I'm really intrigued, I guess, hearing that Bethel is sponsoring these 3 clinics. I think that's really a neat thing. It'd be interesting, I think, maybe going forward sometime in the next year or so to try to get an understanding from Bethel, the big, from the institution, okay, so what are the new things that are coming along that they are working on that we might be able to see down the road? I mean, it's great that the synergy between the 3 clinics is there, but there are other things that Bethel could be a, I'll say a nursing leader or a healthcare leader that would be helpful for us to get an insight into that. That would be worthwhile, I think, down the road.
Our boss, if you will, is Jeff Spiker. He's a DNP and the Dean of Clinical Services, and then Nancy, the Dean, perhaps setting something up.
We could probably defer to Joe to help us get an insight into Bethel.
Yes, our historian.
I remember her from when I was a student.
Really?
Your book?
Yes, my book.
I'm one of them in the picture.
Yes, you are.
We ran into each other at Pace.
Oh, no, now I know.
Any other comments or reactions? Or thank you very much for making the presentation.
Thank you.
It's very worthwhile. Next on the agenda is Fountain Valley Senior Services and Dennis, among others, and April, and maybe others, I'm not sure. The whole crew is here. Good.
Let's pick a PowerPoint and see if we get lucky.
That's impressive.
It was either that or teeth.
Good morning. I'm Dennis Crosser. I'm with the El Paso Fountain Valley Senior Citizen Program. We are located off of South 85-87, serving the greater Fountain Valley area. I am the Transportation Operations Supervisor as a El Paso County employee, and I'm also the Acting Executive Director for the Fountain Valley Senior Center nonprofit. I've been working with Title III since 1990, when I began out there, so I have a lot of history with the Title III funding and just exactly what it does for our organization, or how it helps our organization.
We refer, most of us know Title III by Older American Act funding.
Okay, Older American Act funding. Thank you. I'll stick with Title III because I know it better that way. We provide a very specialized transportation, a very special group of people. I think that basically only Pat and Silver Key and I are aware of. We provide transportation for persons who are 60 and older, and we've done that for a long time. So we understand the greater need of what it is we're doing. In 2006, we also incorporated the Rural Area Meal Program into our program. And so what I'm going to do right now is I'm going to introduce Nancy Bisdock is going to talk more about transportation, and April Leary is going to talk to you about our RAMP program. So I'm going to hand it on over to them.
I'm April. I'm the program coordinator for the Rural Area Meal Program. I'm going to rush through this before I have a coughing fit, but I'll hit all the key points for you guys. And is it the space bar?
Just a down arrow.
Okay. So we try to provide 1/3 of the nutritional needs for our clients. That is a meal a day. We currently have 21 clients, 5 who are in the rural area, such as Peyton, Calhan, Yoder, Rush, Falcon, and then we also serve Fountain and Whitefield. A majority of our clients are in the Fountain and Whitefield area just because of networking and funding. We're hoping to expand more towards those areas. The people we serve are people who are 60 and older. They're homebound or geographically isolated. The meals that they receive are biweekly, and they are frozen, 7 meals per frozen box, and then we have 12 shelf-stable meals per box for the shelf-stable. We have 2 volunteer drivers, and we served last year alone 5,104 meals for the year. And so that's just a tidbit of what we do. Are there any questions as far as the rural area meal program? We do. Yes, we do. I'm sorry. It's in my list. We do Ellicott. Yes, we do Ellicott. And we love Ellicott. So, yeah, we do serve them too. We don't have any in Ellicott right now. Unfortunately, you know, I was networking a couple months ago, but because of funding, I haven't been able to get out there and network as much as I would like. But there is a huge need, I know, that I'm aware of. Yeah.
Well, we do have the food center there.
Yeah.
That's in Ellicott.
Well, and what we've been doing is referring people to other places. You know, if we have a prioritization that we do, and it's basically a scale of what their needs are, their mobility, their nutrition, and we prioritize. And if people, say, are lower on the prioritization scale, we will try to refer them to services in their area, just so that gap can be filled in between meals. Yeah.
I know you had, I thought, 10 in that area.
No, we currently just have 5 at this time. Yeah.
April, how does the 5,100 meals number compare to 2016? Roughly, I mean, is there a continuing increase? Is it pretty much plateaued?
It's plateaued. I don't have the answer for you, but I can get that for you.
I was just wondering, just roughly, I mean, is it a continuing growing
It
number?
It is a growing number, yes. When I first started this position, I really got out there and tried to get in the community. Within a month, I had signed up 6 new people, and it was continuing that way for several months.
Okay.
So there is a growing need. I just think as far as, because we rely on the community, you know, for donations, grants and stuff like that, it's just a matter of getting everything we need to bring more people in, but there is a huge need for our service.
Other questions, comments?
Okay.
Okay.
Thank you, guys.
Hi.
Nancy.
Yeah, I'm the transportation coordinator, dispatcher. So, Fountain Valley right now, we are transporting and providing for those age 60 and over, and we do transport non-elderly disabled living in the Fountain Valley area also. Whoops, went too far. In the southern El Paso County, transportation is available for individuals in the Fountain, Widefield, Security, Stratmore Hills, and Fort Carson. We do provide eastern El Paso County transportation when available for Falcon, Ellicott, Rush, Yoder, Peyton, and Calhoun. Those areas are a little harder to get to, but we do, if we have capacity, try to get out there and support them also. We transport for medical appointments and personal business to and from their homes. We also have programs available and activities to and from the Fountain Valley Senior Center. Whoa, that's going a little fast. Let me go back. And we do not provide emergency transportation. That is not available at our service right now. We ask that our clients have their appointments between Monday and Friday, between the hours of 9 and 2:30, and we do ask for a 48 or more hour advance notice. We have a combination fleet right now of 12 vehicles. We have 8 buses, 3 vans, and 1 minivan. And we do have a new van coming in. We employ right now 9 employed drivers. We have 6 volunteer drivers. 1 volunteer driver supports the Falcon, Calhoun, and Peyton area, and he actually has a bus that stays out there, and he supports them also. We'd like to recognize for excellence Ruben Bastido. He was our driver last year that was awarded the excellence for our driving. And I also wanted to note that myself and Greg, I think a lot of you know Greg, we are the transportation coordinators, and there are 3 Mountain Metro transportation coordinators in our office too, and we all kind of interact with each other and help each other out. So, any questions?
You know, something I think to note, I'm sorry, Francis, I'll interject this real quick, is this group probably needs to know how the Older American Act funding works. A ride is a ride, is the simplest way to put it. And so these folks don't get paid by the mile. There are some things in the works to tier transportation so that there's a little bit of an accommodation for these rural rides, but they're hard to do because it's a whole lot different going 14 miles down a dirt road in Calhan as opposed to taking somebody a few blocks down the road in Colorado Springs. So it's a difficult thing to manage, and we certainly appreciate what they do.
Francis?
I just want to be your advertisement today. The city of Fountain owns their own transit system, and they are putting together a bus route that will be, it's a route that's going to be starting next Wednesday, April 4th. And it is going to be leaving from the Fountain Valley Senior Center every Wednesday at 9 o'clock. And it's going to service those people who are in the Fountain, Security, and Widefield area so that they will have direct transportation to the Citizen Service Center up at 1675 West Garden of the Gods Road. The bus will leave at 9 o'clock in the morning. They make no other stops, so people from that area of the county do not have to rely on the Mountain Metro service where they have to transfer 15 different times. That's right. So it's direct. As I say, it leaves at 9 o'clock. It comes directly to the Citizen Service Center. People are allowed to conduct their business in our facility. And then the bus will remain on the premises until 1 o'clock when it returns back to the Fountain Senior Center. And all of this is at the whopping price of $1.50 for the round trip. So this, and this will service all ages. But this is another thing that the county and, of course, the city of Fountain have been working on for quite some time, and it's taken quite a bit of cooperation between the two entities. And also they had to jump the hurdle of the city's transit system. At first there was some, that they would be stealing ridership. Well, that was proven to be false. But this is another service, and again, it's only going to be on Wednesdays, for at least initially, and see how it all works out. But this service is greatly needed for the clients down in the Fountain Valley area. So that might be something that you might be able to pass on to those that would be interested. And no, it's not from eastern El Paso County. I'm sorry, Phyllis, but we're making inroads. We're making inroads here.
That's right. It's a start.
We try if we can.
I also might add that if you want to hear more about that, we're the Mobility Coordinating Committee, which meets in this room on the 24th of April, will be having a presentation about Fountain Valley Transit, but specifically about that express route.
That's a very positive development, it really is. Thank you for bringing that up. Cynthia?
So if that is done between 9 to 1, the clients will have to have their appointments scheduled between 9 to 1. What happens if their appointments are not made or?
Well, you just work on it.
I can't answer that question entirely, but it sounds as if we met with Todd Evans, who is the deputy city manager from the city of Fountain. It sounds as if since the bus driver will be staying down at our facility at that time period. Say, for instance, one of the riders thinks that they might be a little bit late, that the bus driver could possibly wait for them for that maybe 15 or 20 minutes before going back. I can't say that specifically, but it sounds as if since that driver is just dedicated to that route, that there is a little bit of flexibility there. But for the most part, there were tests run prior to this all being put together, and the leaving and the arrival and departure times were kind of planned around the fact that this would give clients adequate time to get done what they needed to get done. So,
If I could
I'm not answering your question. I'm running around the bush, but
Experience will tell whether
yeah,
or not it works.
this is
And
experience.
what
This
you
is
need to do.
We at the
exactly.
senior
This is
center also,
experimental.
if they have an appointment and they know it's outside of what the city is running, they could call the senior center. If they are already in our system and they're a client of ours, we could take them down there if we have capacity. We do run down there also, so.
Yeah.
Yeah. So if it's outside of that Wednesday time frame and they need to go, I mean, all they need to do is call the senior center and we can see what we can do for them.
Well, I can see, because the center is so busy, you may have but you're just like the doctor's office, well, you got this client, well, you're gonna have to wait, and you have to wait before you know it, the transportation's left.
I expect most people will try and make their appointments at 9, 9:30, 10, 10:30, or 11,
Because everything's by
for that
appointment,
reason.
right, at the end.
Yeah,
Not necessarily, no.
walk in.
We've got DMV there, if there's the assessor, the treasurer, if they want to pay their taxes, they don't need an appointment for that. If they want to renew their driver's license or their car registration or something like that, they don't need appointments for that. And the clerk and recorder's office is really trying very hard to make your trip down there as pleasant and as quick as possible. So, in answer to your question, again, a lot of testing has gone on prior to this, and they really feel that this appears, initially to be very adequate time to get done what people need to get done.
So is this sort of like a precursor for people, maybe like Woodland, who live in Woodland Park, and make something that might be, or is it just Fountain?
Well, it's just Fountain, and remember that Fountain owns their own transit system, where the Woodland Park does not. So Fountain has kind of got a little bit of an advantage here, where they can do things that Woodland Park perhaps can't. Or that the city of Colorado Springs can't.
It sounds like a very promising pilot program at this point, and just kind of see where it goes from here.
Yeah.
I'm sure that the ridership initially is probably, gauged at a smaller bus rather than a 30-passenger or 50-passenger bus. It's probably a smaller group, and we'll just have to see how it goes. But I think it's a great opportunity for a segment of the region here to get that services served.
Yeah. Congratulations.
Any other comments or questions? Me.
I answer a lot of phone calls up at the front desk here regarding transportation, and do you find that seniors need to be sort of educated on the notion that transportation is not going to be instant, that in fact it has to be scheduled ahead of time, et cetera?
When they call, we do tell them that we require a 48-hour notice, at least a 48-hour notice. If they have an appointment within 24, I will do my best to try to get them a ride. We can't always provide that, but we will try to get them one in a shorter notice if possible. But we do recommend a 48-hour notice because we do fill up very fast. And we let them know up front that, that we fill up fast. And so the sooner they know of any appointments, if they could give us a call, we can get them scheduled in. Yeah.
I have one gentleman that her and I dealt with, that he paid Uber $80 to come in, bring him in, wait, and take him back.
Yeah, yeah.
But I did find out, I think there's one person that got a grant from here, over towards Calhoun. I'm not sure, I can't even think of her name right now. But there's two of them out there that I have found that do this. So I'm not really throwing it in the bus. Too much. Not yet.
Thank you very much, Nancy and April and Dennis, for coming.
I want to apologize for my hacking. This weather is not conducive with recording.
And you mentioned the word apology. I would like to apologize for Michelle as well, because I took you out of order, and I apologize. But it's now your time to come and talk to us about community dental health.
You're on. All right. Well, good morning. It's a beautiful day out there. So the first thing that I'd like to address is our name change, our rebranding. So everybody knows us mostly as Senior Mobile Dental, and March 1st was my official deadline. My staff has learned to give me deadlines. So March 1st was our first, or when we officially have transferred over to Community Dental Health. The NPO is for a nonprofit organization.
Oh, okay.
So the reason why we did that is everybody who hears Senior Mobile Dental assumes that we work out of a motorhome or a bus, or that we serve seniors only. And Senior Mobile Dental was a good name when I first founded the organization, because our first program was nursing home care. You know, that's why I did this, is because there were so many people tucked away in the nursing homes that were not able to get out to the dental office, and they were just kind of swirling in disease and neglect. So it was easy for me to go to the nursing home. But I never did this in a van, because I figured if they could be transferred into a van, then what's the difference with them than going on to the dental office? It was much more conducive to provide the care directly in that nursing home facility. And then seniors, you know, and seniors are always my target population. There's a lot of programs out there for children's dental care, but there's nothing for seniors and really adults. And so what am I saying? So we changed because that, but we still focus on seniors. That's our main population. But we needed to expand our age group to adults as well. And then if there's children's, with the family, we see all ages. But it's primarily seniors and then adults. So let's see what I have next. So these are all the different kind of populations. Again, we serve our community. So even Elvis, down there on the lower left, but we have our brick and mortar office. We work out of an office. Our office in Colorado Springs is located in the Senior Center Complex, which was an easy, beautiful place to have our office for our seniors. And it's a good, with the bus routes and everything too. And then we also have an office in Pueblo that we're trying to help the community with down there, and there's a great need. So
you might mention that that's the original location of the aging center, the place you occupy right
Yes, at the UCCS Aging Center. So I think that when our office in Colorado Springs was first built, it was a dental office, and then UCCS Aging Center
was in there for, maybe 10 years or something like that, or for quite a while. And so you guys made that very beautiful. There's a mural on there that, it was pretty, it was very pink, you know.
It was very pink.
It was very pink. It's all mauve, and so we had I didn't have the money to replace all the cabinetry, but we painted doors and toned down all that mauve, so it's, whenever you're in the area, come by and take a look. I think it's a pretty pleasing atmosphere. At least all our patients really feel comfortable in there. So, meeting the needs of our community, there's just so many different. Well, actually, let me go back a little bit on the community dental health. Why did we choose that name? Because we're serving the community, but I just have really been working so hard that we really need to bring medical and dental together. The head is not separated, the mouth is not separated from the rest of the body, and there's just so much research that's showing oral disease is affecting the physical health. So that's how we came up with our name, and I think that everybody, do you guys like it? Is that a good name for it? Yeah, I'm really excited because I've really struggled. We've had a lot of names. I started off with licensed dental hygiene care, then it was senior mobile dental, and then when Medicaid dental benefits came about, then I added Medicaid dental home, and then, so we've had a kind of a struggling on our branding, but this is it. This is a good one. So there's just so many different ways that we've been able to impact our patients, and so there's the sociological aspect. There's a lot of people that are embarrassed of their teeth, and so they do tuck away and don't get out and socialize. Just even how it does affect them physically. This example was he was a nursing home resident, but he just was really wheelchair bound, and after we got his mouth healthy again, it really took all the nursing staff for a ride because he was out moving around, and they had to really stay on top of him, and he was feeling so much better. He could move again, and so that was another way. This guy, he's 64, and he has a lot of life left, and he hasn't had the confidence to even want to go out and meet anybody or date or socialize. And so, there's a lot of people like that too. With us being next to the senior center, that's a big socialization. And a lot of people, when we first see them, they haven't even been in there because they don't, and they don't want to be there for the lunches, or because they can't chew, or they have difficulty chewing in front of people and stuff. So, Teresa, she had quite a bit of physical health issues, to where she had a lot of abscesses, and it was going septic and affecting her, to where she did have to go to the emergency room. Well, 5 times, she said. So once we got all that infection out of her mouth, she's regained her health back. And it's really not that hard to even do that first step of integrating medical and dental together. And what I try to encourage is just even asking on the health history. When was the last time you had your teeth cleaned and checked? Asking when was your last dental visit isn't really good, because the majority of the people that we see will go to the dentist for one extraction because they're having a toothache. So that's really not addressing the disease in their mouth. So just to have that one question, and with diabetes and the nutrition aspect, a lot of research shows, that periodontal disease and diabetes go back and forth and are related. And so again, that's why with community dental health, I'm hoping to drop that little drop of awareness again of that it is your overall health. So on last year, our patients, 23% of all the patients that we've seen were participants with our Older American Act. And so, our state grant is our greatest funding source, and you guys are right there with us. You are making a huge impact on the need of our community, because you're hitting that gap where if they don't qualify for the grant. So the state grant and Medicaid has financial limitations. And so there's a lot of people that may not hit that low-income financial bracket, and so then they don't qualify for Medicaid or the state grant. And that's where your guys' support has really made a huge, huge difference. We're facing, we have a huge wait list. Last year was the first time we've ever had a wait list, and then this year. So right now, I think we have around 117 people waiting. But my staff knows that if anybody is calling because of pain or infection, they're in immediately. That wait list is irregardless. So I'm really excited about the carryover funding. Knock that wait list out. So, and then, there's, with Medicaid, there's a Medicaid gap. And I had a meeting with Sal Pace. He's a legislator out of Pueblo. But I don't think that the state really realizes this gap that's happening, and why we're having this wait list is because people who qualify for Medicaid, as soon as they become eligible for dual eligibility, I think it's when they turn 60, sometime between 60 and 65, they then go from Medicaid into Medicare, and then that's a dual eligible. They get both of those benefits. Well, as soon as they get that dual eligibility, their Medicaid dental benefit is out. Then they don't have any dental benefit. So it just doesn't make sense. I mean, if they qualified and they needed that dental benefit, just because Medicare does not cover dental. So then that's where my state grant and your guys' support is is helping. That's all these people that fall into that dual eligibility. So the kind of procedures that we've been doing. So also last year with the carryover funding, it was, last year it was really becoming evident to me that the veterans were not also receiving any form of dental care. There's only a small percentage of vets who qualify for dental care through the VA, and the majority of them do not have any support. And so with last year's carryover funding, we used all that money strictly for veterans outreach. And that's continued into this year. So there is a lot of, older adults are veterans, and they really need that help. And that's been just really incredibly rewarding, the stories that we hear of the vets and what they're going through, and their experiences. I want to try and record everything because there's some stories that, I don't want to get lost with them. So anyhow, the majority of our procedures are preventive, so it's the cleanings, exams, and x-rays. And then the next is really extractions, because the people that we see by the time they finally get into our program are in such advanced disease and neglect that it's really looking at which teeth are salvageable and which ones are just too far decayed or, broken that they need to come out. And so with those extractions comes the dentures. And a lot of the denture work is full upper dentures. And then any bottom teeth that we could find to save, because full upper dentures work, because it can suck up to the roof of your mouth. But lower dentures are a complete nightmare. There's nothing to hold a lower denture in. Your tongue moves, your lips move, the floor of your mouth moves. They don't stay in. And so when we do our assessments, we look for any teeth on the bottom to save, to then build a partial denture around, because then that's their own implant. Everybody hears about implants and stuff, but those are so incredibly expensive. They're $2,000 to $3,000 each tooth. And so we kind of encourage a lifestyle change, knowing that, look, this is your own implant, and you need to keep, what teeth we can save for the rest of your life so you don't have any issues. Any questions so far on anything? Okay. Yeah?
Has the mobile component of your program decreased since you've gotten an office so close to where your targeted population?
Yeah. Even with Teller County, because we used to go to Cripple Creek regularly. And but with us being in the senior center, a lot of those people go to the senior center, and so they just make that trip all together. Also, we really we work with them on their transportation, and so all the transportation agencies know that, I want you guys to know that even if there's, we'll try and combine their appointments. We won't have them, okay, come in and fill the paperwork out, and then you got to come back for the x-rays, and then you got to, for all these multiple appointments. Especially if they're relying on transportation, we try to be effective and efficient with their transportation needs. And then even with the rural regions, if there's a few of them, we'll schedule their appointments together, and save that whole transportation piece. We'll make our schedule work to collaborate. It's all collaboration, I believe in.
Is there still a mobile component?
Yes. And so if, for example, we had a group of people in Teller County who needed to be seen, then we'll go out there, but not just, it's not conducive for me to bring the whole team out there for one or two people and shut down the office. So, we always try, if there's a group, we'll go out there. And there's the health fair coming up in Calhan in October or something, that we're going to bring everybody out there for that. And even, for example, we still have one of our nursing homes in the Aspen Valley region in Rifle. And so next month we're taking the whole team out there to Rifle. And we go to Canyon City and stuff like that too. So yeah, and our nursing home program is still there. That's my baby, that's that's not going away. So that's about it. The big thing that, besides our name change, we were awarded social innovation in the Edison Awards. So next month I'm going to New York to receive our award. And I really, again, it's just a way that I can bring attention of the importance of dental care and oral health and into overall health, and hopefully we can get some corporate sponsorship out of that too, because it's just little us, but these are all Fortune 500 big companies with there's all different categories, so it's all these inventions, these new things that are coming out, and then there's us. So our big thing is we have a capital campaign that, if I'm still alive, I hear that these are pretty bad capital campaigns, but in Pueblo, the office that our office over there, the dentist is retiring, and so he's selling the building. And they approached me and, said, well, why don't you buy the building? And my board approved that. But now I got to raise that money, so I'm hoping that, I see all these, I'm in that philanthropy news digest. There's always all these emails, Dow gives $15 million, and there's all millions given out, so I just want 1.5.
No problem.
That's all. Just, it's a drop in the bucket for them, right? So, and what I'm excited about that building is because there's all different wings, so I get to, again, push my interdisciplinary care. So I'm going to have a nurse practitioner in one wing and all different disciplines in that building, and make it a convenient overall health care if they want it. So, all right, you guys, thank you so much.
Did you change your website because your email is still?
I know. That's it. So I still have, there is Michelle at communitydentalhealth.org, but I haven't figured out how to push that into my Outlook yet. I've had to do our RFP. I just turned in my application, and so I've been working on all that. I think if you go, it'll push. If you look up Community Dental Health, it'll go over to our site and stuff. So, but that's all. That RFP was most important, so I had to get that done, and I think that's my next task is to clean up now that whole name change thing. I haven't even gotten my new name badge yet, so.
Thank you very much.
Thank you, guys. Thank you.
Okay, next on the agenda would be the director's report. Joe.
Thanks. I'll try to be fairly brief. I'm in an unenviable position because I like to talk about programs, I like to talk about innovation, and all anybody wants to talk to me about is federal funding. So I will tell you the federal funding story. The Office of the Controller at the State of Colorado has approved, I think some people already know this, has approved that we can encumber the federal funds which have not arrived, which normally arrive last June and have not gotten here yet. They've allowed us to encumber those, so I was telling somebody a minute ago, the best analogy I can give is that the money's in the bank, but the book of checks has not gotten here yet. So we can start spending that money, and we'll most likely be able to put our March expenses into that category. We did such a huge shuffle with state versus federal money to try to keep everybody afloat for the year that we're going to have to put all that stuff back where it started and then replace it with the federal money. So that's going to take Casey a while to do that. And once we get that done, then folks will be able to start spending that money. And Michelle also alluded to the carryover money, which in some cases was, some areas was fairly substantial, some areas it was not. We will make that available. We're still working on the process to do that. Normally we would do a small RFP process last October to allocate that money. Since it's coming in so late, we want to get it out just as quickly as possible, so it probably will not be a very elongated process, and we'll let you know when that opens up as to how that's going to happen. It's going to, the one thing you can count on is it's going to be fairly quick because we want to get the money to you in time for you to be able to spend it. So that's real important. The state Unit on Aging is converting to a new data collection system, so it's called PeerPlace, and I think I've talked about it in the past. We are in the midst of reviewing the initial transfer of information. It's a little daunting. Lisa and I and Gretchen spent yesterday looking at the process to kind of verify that the data came across appropriately. We're going to have a blackout date in about 3 weeks for 2 weeks, so there's 2 weeks where we won't be able to put data into the system at all. And this system is the system that contains all of the charting notes, all of the individual records of the clients. It's an encrypted system. It's fairly complicated, and it's going to be a lot better when we get it done, but it's not a lot of fun right now, as anybody that's gone through a data conversion knows. So we will be working on that over the course of the next month. It just so fortunately fell right on top of our RFP cycle. So we got a lot going on right now. The RFP is in process. They were due last Friday, the 23rd. We will be reviewing those and processing them, putting them in a final format for the TRS, and the TRS meets in about 2.5 weeks, I think, to start working on that.
They meet a week from tomorrow.
A week from tomorrow.
April 6th, 8:30
Week and a half, sorry, yeah. That process is a 3-meeting process and involves an initial kind of education. We do a formal review, get some questions back from the providers, and then a final will go to the RAC at the May board meeting and to the PPACG board at their June meeting. And then from that point forward, we allocate that money. We don't know what that amount of money is. That's one of the challenges. We know that the governor has put an extra chunk of money in his budget. I don't know if anybody's been following the state legislature, but the state of Colorado is going to make out pretty good with the tax bill that went through. And in addition to that, the economy is doing really well. So we have more money than we have had in the past. The governor elected to put a chunk of that into his budget, and hopefully about 11.7% of that will funnel down to the Pikes Peak Area Council of Governments and into our programming. So we don't know how much the total is going to be, but we know there's probably going to be more than it was last year. Somebody's got a cell phone somewhere. Yeah. I want to thank everybody that attended Senior Day at the If you went to Senior Day at the Capitol, just raise your hand. We had an incredible representation from the city of Colorado Springs. I know Jody Barker was there. I know there were a lot of folks from the Colorado Springs Commission on Aging, and I appreciate everybody that took the time to come up to the Capitol and show support for that program. The Supreme Court chambers was packed, and Dave may talk a little bit about it. It was a positive day in general. As far as legislation, as anybody that follows the state knows, the main focus for this year is going to be transportation, getting some long-term transportation funding in place. One of the hot topics, and in relative to seniors, is going to be the homestead exemption reforms. We know that the homestead exemption that we've had in place for several years is not a sustainable option. It was $84 million to fund that program 5 years ago. It's now almost double that, and is predicted to go up probably by threefold from the current level. So it's not something that we could keep funding on a regular basis. So they're looking at how do they do that, and do we look at a sliding scale, income qualification. One of the big components that people gripe about is the fact that if you downsize in your older years, which you should do in a tight housing market, you should downsize and allow that big house to go to a family, that you get punished because you have to be in your house 10 years to get that homestead exemption. So they're talking about ways to reform that and get a little bit more equity in that area, and we'll try to keep people informed of that. Once again, if you're interested in following those things, the Colorado Senior Lobby has a great website that keeps up to date on that, and they have somebody in the Capitol all the time. That's a nonpartisan group out of Denver that does a super job of keeping on top of that. A couple other things that are coming up are a lot of reforms to prescription meds. The pharmacy companies are going to take a pretty good hit this year in terms of what they are allowed to do in terms of jacking up prices, particularly on generic drugs. And then there's a bill that's really interesting. I think it's a secure savings account bill where it would create a state-sponsored plan for folks who do not have access to 401ks and 403bs at their work, and it would allow them to put money in. It doesn't have anything to do necessarily with current seniors, but it has a lot to do with people who are going to support us when we get into older age, so that they don't have to be on programs at the same time that we're on programs. Any questions for me?
Appreciate the update on the state stuff, because I don't always check in on that, so that's always good to hear your updates from what's going on.
Absolutely, and I would encourage you to look at that Colorado Senior Lobby website. It is so good and so well maintained. They have people to sit in on all those hearings, and so when something changes, you know it that afternoon rather than a few weeks later.
Thank you, Joe. I'll just piggyback on the senior day as well. So Phyllis and Lucy and I went up on that, and I thought it was very interesting, very informative. Been there a couple times. I think this is my third time. So I'll just kind of quickly run through a couple things here that struck me. So we had Governor Hickenlooper, Lieutenant Governor Donna Lynn, Mayor Hancock, and I think 6 or 7 of the legislators, both representatives and a couple senators. Governor Hickenlooper, very polished, looks like he might be running for something. He highlighted the success of the Strategic Action Planning Group, which Joe has been on, I think. Weren't you on that?
No, Claire Anderson.
Okay. But anyway, the Strategic Action Planning Group, and I have a flyer on that. It has a lot of good information available on that as well. He introduced and talked about the senior advisor. The new senior advisor to the governor, established for 3 years, is a gentleman named Wade Buchanan. Governor Hickenlooper touched on age-friendly and boomer bond program as new things and strengths, if you will, for the state. He was pleased with a bipartisan progress on health care. He specifically mentioned that he and Governor John Kasich of Ohio were working together on this, and that Democrat and Republican had come together on some resolution of some of the on how to discuss health care, not necessarily resulting in an actual proposal. He also said that we're the #1 state economy in the United States, which is a healthy thing as well. I think we've all seen that and are benefiting from that. And his emphasis seemed to be on infrastructure. Again, very polished, very smooth presentation. It was interesting to me to see him from a year ago to this year. Wow, what a difference. He's had a lot of good advisors, I think. Yeah, Donna Lynn, Lieutenant Governor, she also is running for governor this year. She emphasized, she spoke very briefly, effectiveness and efficiency at the governmental level, and talked about the need for accountability and the use of metrics in most of what we do as a government, to try to make sure that there is some sort of accountability and measured progress. You can see where you're going. Mayor Hancock of Denver, he had a couple words to say. He said Denver is #3 in the U.S. for number of baby boomers, and Denver is also #1 in the U.S. for millennials, which is kind of a nice mix. So #1 millennials, #3 for seniors and baby boomers. He also indicated that the city is overburdened with the needs of seniors, just that there is so much going on, there are so many needs that they have, and they're just having a hard time addressing all that. The other point I thought that was interesting he made is that 20% of the homeless in Denver are senior women, which I'm not sure I've seen that same figure reflected down here. I don't know if there's that sort of data on it down here, but again, that was kind of interesting. That's a pretty high number, at least to me. Just a quick reflection would be that I thought it was very telling that Mayor Hancock was there. Obviously, this is Denver-centric. It's Colorado Senior Lobby putting on Colorado Senior Day at the Capitol. But at the same time, I'm saying, Mayor Suthers, you should be there. This is the fastest-growing county. This is a huge area. The mayor really needs to be at some sort of a function like this to at least say, okay, here's what Colorado Springs is doing. We could take credit, and I think we should as a city, as a region, for some of the innovation and some of the new things that are being done here. Innovations on aging, the UCCS Center for Aging, the Lane Center, all of these types of things. This is where a mayor really needs to come forward at that venue and say, hey, Colorado Springs is really playing seriously and working hard on these issues as well. I think that's an important piece. So I would like to be able to do that. I haven't figured out exactly how yet, but I figure maybe Joe and the executive director here would be able to say, okay, Mayor Suthers, you really need to be at that annual get-together. Last thing I touch on is the legislature itself. Some of the things that were talked about there, I think Joe touched on them. The transparency on drug pricing, the increases, the rapid increases year to year. There's a real serious emphasis on that this year. Multiple bills. I think we heard from, I forget the senator's name, but she, I think, was very, very positive, and I think she had bipartisan support to get the bill through. Affordable and accessible housing. We've all heard about that in various sessions over the months and years. So there's an increasing emphasis on that. In that venue in the legislature, they seem to be talking more about rentals and the changes to the code to make sure that people are not evicted out of their residence. The other thing, or the last thing in the legislature I thought that was new, and Joe, you might have more on this, is that I think this is the first year that they've established a legislative caucus on aging. So this is really an important piece. It sounds like, yeah, it's just bureaucratic, whatever. But nonetheless, it really does mean that you've had bipartisan Democrats and Republicans, different parts of the legislature, House and Senate, that are saying, this is such an important issue, we've got to have a caucus. We have to get together and hit these issues sort of in a, if not in a nonpartisan, at least in a bipartisan. We can still come in with differences, but at least we're forcing ourselves to say, this is important enough, we've got to get our colleagues to understand aging is really an issue. It's coming forward, it's coming at us, we need to be able to react to it. So that was a very positive thing. Excuse me, I'm overcoming a cold here. Last thing I'll throw out is that I've mentioned before that there are a lot of good resources, and I'll give this to Carrie afterwards, but senioranswers.org is the Colorado Gerontology Society. That has some good information. I checked on the Jeffco Council on Aging. That's another good site, and I think there's a lot of good information, again, from a different venue than us, but it gives you some perspective. And then Housing Colorado also talks to both affordability and accessibility, especially as it impacts on seniors. And just to foot stomp what Joe said, the Colorado Senior Lobby, their website is coloradoseniorlobby.org. Wonderful amount of information, and they have a great newsletter that comes out. So again, this is one of those things, and the cost is nominal, but it really does have an impact. As Joe pointed out, they do have volunteers. It's mostly volunteer run. Volunteers are the ones that go and talk with on a daily basis with the Senate and the House staff members and actual legislators to talk to them about the issues that are of interest to the seniors in Colorado. So again, I guess that's kind of what I would throw out here as my comments. Thoughts and reactions? Excuse me. Anybody else? Calendar events, Carrie?
We have the TRS meeting. All RAC members should have received an email by now reminding you that the meeting is a week from tomorrow at 8:30. It's in the upstairs conference room. You are all welcome to attend. However, it's only mandatory for the TRS members. So if you have something else you'd rather do on Friday morning next week, you are excused. We do have continuing Medicare 101 and Social Security 101 classes, and I just want to put this on everyone's radar screen that in May we will have the fourth annual presentation of the ENT retirement series. So in addition to Medicare and Social Security, there will be estate planning, and I've forgotten what the...
Dr. Pauls comes and talks about retirement in general.
And, right, this really, the transition from active engagement as a worker in the community to how to stay active and engage yourself after retirement. Thank you, Joe. And I think that's it.
We really encourage people to get the word out about that Medicare 101 and Social Security 101. Those classes are incredibly valuable. Best way to put this, we fight a battle constantly to get our word out because as a federally funded institution, we can't buy advertising time. So we rely on word of mouth a lot, and oftentimes we're working against entities who are selling a product to get their services. We do everything for free. We are the SHIP office for this region, so we're the state health insurance program. So if you need to know anything about Medicare, this is the best place to come, because we're not going to try to sell you something when we tell you about it. Plus, we've got the state SHIP trainer in our office, which is a wonderful thing to have as well.
Any other comments as we look at the last item on the agenda, which is community information? Anything else any other members like to say something at this point?
I have when we went up for the aging, I have the information, if anybody would like to take it, look at it, for their own information of what was actually going on with all of this up there. I have it here, you're more than welcome to it.
Okay. Anything else? I'd just like to, sort of belatedly recognize that the Edison Award is really a pretty big deal, and I think we really should comment and publicly acknowledge Michelle and Community Dental Health for their recognition. If there are no other comments or community information, can somebody make a motion for adjournment?
I second it.
All those in favor? Aye. Perfect, we are adjourned.
Yes, it was amazing. It was amazing.
We didn't even need a break.
The extra ones, so keep a set for yourself, but extra ones you can leave with me. Yeah. And I'll send out an email and let anyone.
Wow, if we had unlimited hours in the day, we could be checking all those websites.
I know, just sit there and stay online all.
And it's great, though, that there's people that attend all those hearings and are speaking on behalf of seniors. That's great.
It is.
So I wanted to ask you
kind of bring it back to the
about.
table.
Let me turn
Right,
the
right.